This course can cover a wide range of topics in bioethics. This time, it's focused on issues that arise as a result of the COVID-19 pandemic. And there's a wide range of issues here. Sometimes it's just little things like, do you have an ethical obligation to wear a mask? Sometimes it's about public policy, like how do we decide when to quarantine people or to impose a lockdown? When is the risk low enough to reopen? And how do we balance the costs of quarantines and lockdowns against all of the economic harms that those do? How do we govern disease surveillance? Should we be tracking people to see who they've been in contact with? Should you have a document saying you've had a recent negative test in order to get on an airline? What about vaccines? How do we conduct research on vaccines? Should we expose people deliberately to a disease that we may not be able to effectively treat? Who should have access to vaccines and other scarce drugs when they become available? How do you work out the priorities? And how much should they cost? Should pharmaceutical companies be able to charge unlimited amounts, or should government step in to regulate that? When we run out of ICU beds and ventilators, how do we decide who gets the last one? How do we decide which patients get priority? How do we address the health disparities that COVID-19 has brought to light? Although this is a 4,000 level class, there are no prerequisites, so it can be taken by almost anybody. Also, it's an asynchronous online class, so you can fit it into just about any schedule. Finally, this is an approved elective for the new certificate in biomedical ethics. I hope to see you in the spring.